the Rock Island County Health Department's plan with Neil Ludwig. Let's go ahead and start with Dr. Katz, please.
Hello, everybody. I know that boosters are of great interest to the public, and I just want to make a point very strongly that getting boosted now is not an urgent or emergent issue for anybody. So while we get all the final recommendations from CDC and set up whatever programs we need, people need to be a little bit patient. This is not an urgent issue. What is important to emphasize is that getting the primary series, first 2 shots of an mRNA vaccine or 1 shot of the J&J, which all 3 remain remarkably effective to prevent serious illness regardless of interval following immunization, is the most important thing. Second most important thing is continued and increased adherence to public health recommended non-pharmaceutical in the short and medium terms to control the epidemic. When we look at our epidemic curve in Scott County, the daily activity has reached and surpassed the highest levels that we saw important that we need to be paying attention to physical distancing and masking with much greater fervor than what we are. For age cohorts not eligible for vaccination, particularly school-age children and younger, immunization, primary immunization, independent of boosters, of their age-eligible contacts, parents, older siblings, etc., and adherence to mask recommendations remain very critical. So last week, the FDA, on the advice of their independent Vaccines and Related Biological Products Advisory Committee, the VRBPAC, authorized the use of booster doses for recipients of the primary Pfizer-BioNTech vaccine. With that authorization, then, the CDC's Independent Advisory Committee on Immunization Practices, what we call the ACIP, met Wednesday and Thursday, and the CDC has now recommended boosters, a single 3rd dose at or beyond 6 months after completing the primary Pfizer series for 2 groups. Those are Pfizer recipients 65 and older or living in long-term care who have completed their very modest but good data that there's been a very mild downward shift in the efficacy of the Pfizer vaccine preventing severe illness in those groups, the aged and residents of long-term care facilities. The second recommendation was for Pfizer vaccine recipients 50 to 64, so a little bit younger, with high-risk conditions, same high-risk conditions we've been talking about for the entire pandemic, who completed their immunization 6 months or longer ago. This is based on evidence that boosters increase certain test tube measures of vaccine response, specifically antibody levels. There are very limited, essentially no data yet, that these boosters are needed to prevent severe outcomes. We don't have data in that younger age group, even with high risk, that vaccine effectiveness is waning at this point. They then made 2 further recommendations for 2 groups based on each individual's risk-benefit assessment. So that would be individuals 18 to 49 years of age, 6 months out from completing their Pfizer series, who have high-risk conditions as referred to above, and they need to consider the benefits and potential risks of a single additional booster dose and can be boosted if they decide that it's appropriate. This is based on very limited evidence, but it attempts to be proactive in anticipation that as the data evolve over the next weeks and months, there's a high probability that some clinical benefit will become apparent. While the ACIP was divided on boosters for people 18 to 64 in occupations and settings with a high risk of exposure, this would include things like healthcare and other essential workers that we identified early after the availability of vaccines. The ACIP was divided on the need there, and that was based on essentially total absence of evidence of clinical need at this point, and the availability of highly effective non-pharmaceutical interventions to prevent infection, physical distancing, masks, etc. The CDC director has elected to go ahead and make a recommendation permitting those boosters based on individual risk assessment. Booster recommendations for recipients of the Moderna and J&J vaccines were not made because the vaccines have no authorization from FDA at this point for third doses. And the data on the status of the protection they offer over time are not yet mature. Information that would support boosting those vaccines with a dose of Pfizer are not yet really robust, ready for prime time. So you need to stay tuned over the next weeks. And I'm certain that recommendations for both Moderna and J&J will be forthcoming. The data being used to make these recommendations is accumulating rapidly, literally day by day. And these recommendations, I'm positive, will change over the next weeks and months as the data directs us. That's the cost of making critical decisions with real-time data developing on a day-to-day basis. These vaccines remain highly effective, especially for the prevention of serious outcomes and hospitalizations, including Delta infections. The completion of primary series for everybody eligible in the population should be our main focus for immunization programs, and adherence to appropriate non-pharmaceutical interventions, masking and distancing, remain critical. That's my prepared remarks.
Thank you, Dr. Katz. We're also going to hear from Nita Ludwig with Rock Island County Health Department. Go ahead, Nita.
Morning. So today is the Rock Island County Health Department's Pfizer Friday clinic here at our office. And we are ready to give booster shots as recommended by the CDC and Dr. Walensky. However, we can't give the booster to patients until the Illinois Department of Public Health adopts the CDC's recommendations. So we will offer booster shots even later today if those recommendations come to us, which we are expecting to get them at any moment. Boosters will only be given to people right now who whose second dose was at least 6 months ago or March 24th or earlier. As a reminder of what Dr. Katz said, the boosters can be given pending IDPH approval to those 65 and older, residents in long-term care facilities, people aged 50 to 64 with underlying medical conditions, people 18 to 49 with underlying medical conditions, people aged 18 to 64 who are at increased risk for COVID-19 exposure and transmission because of occupational or institutional settings. The hours of our clinic today are 9 to noon and 1 to 4, and those are walk-in. We will give boosters only to people who received the Pfizer vaccine. No approval has yet been given as of yet for Moderna and Johnson & Johnson. And right now we believe that we have the capacity to serve clients here at the health department We could consider opening a mass vaccination site if the demand warrants it. Unlike in the spring, COVID-19 vaccines are now readily available in the community at our healthcare and pharmacy partners. Even if you receive both shots of Pfizer from a health department, you do not have to return to the health department for that booster shot if you're eligible. Our clinics right now require no appointment. However, if the demand grows beyond social distancing capacity, we could implement a sign-up process. We will communicate any process change broadly through all of our media partners, on our website, and through our social media. We also are continuing to give Pfizer and Moderna booster shots for the immune-compromised patients. They can be given 4 weeks after that second dose. Our Moderna clinic is on Tuesdays. Masks are required at the health department and social distancing guidelines will be enforced, which could require lining up outside if it comes to that. Thank you. That's all I had.
Thank you, Nita. We'll give it a minute or two, see if we have any questions from our media partners on the call. Please type those into the chat and we can field those to Dr. Katz or to Nita. Here in Scott County, the health department continues to offer Johnson & Johnson 1-dose vaccines here on a walk-in basis. That is from 8 a.m. until 4 p.m. Monday through Friday. So that will continue as long as supply is here in the community. Members of the community can find Pfizer doses in Scott County by visiting www.vaccines.gov, and information is there on where those are included. And I think when we were having, Dr. Katz, your audio was cutting out a little bit on Scott County numbers. I don't know if you were giving any numbers related to spread or if that was related to the recommendations, which will come in that press release and was related to what Nita just shared as well.
No, all I said was that our population rates have now gone beyond what we saw in March and April last spring, and look like they're continuing on the way up. So we're over 40 cases per 100,000 per day, 14-day moving average, and we can provide the epi curve as a visual if anybody needs it.
Yes, you continue to monitor those and make comparisons as needed to help us determine what's taking place. Okay, I don't see any additional questions that have come in. We will follow up all of the information that was shared through a press release, as well as some of the images that Dr. Katz mentioned. You can find all of this on our website, as well as on our social media pages. The recordings will be posted there. Thank you all for joining us today on somewhat short notice. We wanted to make sure this information and the letting the community know that this is not an urgent matter and it's not an emergency for these doses to be given out now, but that it is a recommendation that's coming from the CDC. So we appreciate any support you can provide us in sharing that information. Thank you all for joining us today. Have a great afternoon and a wonderful weekend.